So now I have many people say to me, oh, no, I don't have any swelling. And I say, maybe not.
Right.
Because it really depends on, I have that 30 to 50% increase. And when you've had a lot of tissue trauma and surgeries, you're almost guaranteed some level, because what research also shows is your lymphatic system acts as that overflow valve for your sink or your bathtub. So I fill up my sink or my bathtub, and then the phone rang and I start talking, and there's the car problem or something, and I go, oh my gosh. So I go over, hi Kathy, I go over to deal with that, and I forget to turn off my water, you know? And so it starts going out of the overflow. So when we've had tissues that have been traumatized, they are using the overflow system, which is your lymphatic vessels. The lymphatic vessels can usually on average move about 1.5 liters of fluid a day. But in a situation where they need to, they can move up to about 3 liters of fluid a day because of their reserve. When they're supported, stimulated, and worked with correctly and properly, they can move a lot more fluid. And because of that, it becomes very helpful to stimulate the lymphatic system so those tissues get rid of the fluid. When we've had trauma to our lymphatic system, like you were describing with a complete tendon reconstruction, lymphatic vessels will grow in there, but they grow in smaller and in fewer numbers than would be there if they were normal and healthy and not surgeried. So doing the stimulation and supporting that fluid return is super important. So that's what I'm going to talk about today. But before I get started, because we're about 5 after, I have to do the disclaimer because, you know, it's the website. So number 1 disclaimer is you are being videotaped. This is a recorded session. And I do share this with people online, both through YouTube and other video means, including social media. So if I have permission to use your video, please wave or give me a thumbs up so that I have your permission, and I need your permission too. There you go. So the other thing is that because I have not done an evaluation on all of you online, I do evaluations online, but not in groups. So because I have not done an evaluation on you, this does not count as physical therapy, because per the Physical Therapy Practice Act in the state of Texas, I have to do an evaluation on you one-on-one to get your medical history. So this does not substitute for one-on-one medical care or physical therapy services. This is considered fitness and wellness education, which I can do under my Practice Act. Number 3, what I'm teaching you is proprietary information that I have put together after a great deal of continuing education. I have studied and worked with fluid and swelling in the body for more than 20 years now. So this information can be shared with, you know, your spouse, but is not to be reproduced, copied, or used in any other commercial way without written permission. All right. Oh, and wave to those permissions and understandings that I know I'm not getting physical therapy, and that is under a different umbrella. Okay, so we got all the disclaimers out of the way. Somebody always comes in the minute I finish that. I even waited to do it longer today so that. Okay. So Susan,
sorry.
Wave that you agree with all the disclaimers you heard at the last session you gave to.
I do. I'm sorry, everybody.
Okay, because I just finished all those. Okay, so last session, I talked generally about lymphatics or about how to address swelling. Now, the reason I talk about that generally first is because if my lymphatic system is not working in the general area and as a gross overall big system, then if I get specific, I'm not able to move that specific fluid back out of the area that I need to move it out of because it's got no place to go. So I know a number of us are in Texas. So you might remember when there was that big hurricane in Houston, basically tried to evacuate to Dallas. Dallas couldn't absorb them. And we had a parking lot on the freeway in between Dallas and Houston, which became a huge problem, bigger than the hurricane was. So when we open up our system, generally, like we did in the session a week ago, able to then prepare the roads and prepare the pathways. We are able to prepare the roads and the pathways for these specific areas of our lymphatic system to then release and move their fluid, and they have an open highway because we've made appropriate preparations and said, okay, we're going to turn all the highways to go one direction, which lymph only goes one direction anyway. But we've made those preparations by opening up our deep lymphatic vessels, because the lymphatic goes from superficial, then it goes deeper, then it goes really deep. And so in the first video, I was showing you the really deep, because if you do the deep and then you get specific, there's places for that fluid to go and it continues through your system. Otherwise, you just move the swelling from your knee or the swelling from your hip up to your stomach, but it still can't move if you don't do the steps that we did in the first video. So I'm going to review those super quick. We did the collarbone. So I just did some gentle pressures above my collarbone. I'm going to move back, move my camera down. Then we came in and did this area. This is a very crucial part, because all of your intestines, all of your pelvis, and both of your legs are converging lymphatically into this point. It actually has a special name called the cisterna achilli. You don't have to remember that. But so I want to stimulate that. So then I did my Y shape in that other video. And so that opens up all of my body cavity to move fluid. Now I'm ready to do some of the specificity or the specific areas that I need to do in my knee, in my thigh, wherever I want. But in order to work specifically, it becomes very valuable to know what my body feels like. It is hugely common for me in my practice that I will open up somebody's vessels and their tissue gets all soft, and I say, wow, do you feel the difference? And they'll say, I didn't know what it felt like before. I realize that so many people really don't know what their body felt like. Like they don't go. It's really hard when they feel their leg. I want you to take an area of your body that you feel is a reasonably healthy, if not incredibly healthy area of your body. So, I'm going to do this on my thigh. And I'm just going to feel my thigh. Now, I'm not digging on it. I'm not pressing down hard. I'm just noticing what the tissues feel like. Like, oh, there's something kind of tendony right there. It's your ITB, your iliotibial band. You don't have to know the names of this stuff. I want you to know what they feel like. So the names are much less important. Those tissues feel, and don't forget the back side of you, because the back side of you is every bit as important as the front side of you. So I'm noticing how all those tissues feel, right? I'm noticing that my skin, and I'm going to show you this on my arm because it's just better on the video. So I want you to notice, you see that stretch of my skin on top of the muscle underneath? Okay, I want you to feel that too on your leg, on your, even on your tummy. Does my skin move well? Okay, keep in mind I do this for a living, so mine moves pretty well. But what you're looking for is, do I have an area where it doesn't move pretty well? Do I have an area that's more stuck? It feels lumpy. Hey, Kathy's agreeing with me. She's got some areas good. Because the goal is not to have those areas, and that's what we're going to talk about. So if I feel my abdomen, and again, they didn't teach us camera angles in PT school, so sometimes I have to play around with them for a minute so that you can see me. So I just want you to kind of, I'm using the padded parts of my fingers. I am not using the fingertips. I'm not digging. I'm gently just pushing around. So when I hit this spot right here, I was like, ew, that's a little uncomfy. Not painful. You're not going to use enough pressure to be painful. But it's like, there might be a little congestion. So when I'm saying congestion, I'm not talking about sinus congestion and you know, stuff in your nose or stuff in your lungs. I'm talking about lymphatic buildup and fluid buildup and things not moving through your intestine. Okay, so when I feel a firm area like that, so we're going to start with the abdomen here, and then we're going to go into the leg. So if I feel that little area of firmness, I'm going to use the padded parts of my finger, and I'm going to sink down into my body gently. No pain, all right? Theory, no pain, no gain does not apply in this class, ever. Doesn't apply in any videos I do, quite frankly. So we're going to sink down, and we're going to imagine that we're on an ice cube and it's just leading us along on top of that smooth kitchen counter. So we're going to follow that through the pattern that it wants to go. So it goes in all these different directions, right? I think you can see this on the camera, is that my fingers continue to sink gently deeper into my abdomen, right? Because that area of congestion is I'm following where it needs to go in order to kind of get drained and get that fluid to move out of there. So now I'm going to come back and I'm going to go, yeah, this actually feels softer than the rest of my abdomen area now. And there's a little firm right there. So I do the same thing. I sink on that area and I follow it around until that area starts to get nice and soft, stretchy and mobile. And then I can go, yeah, feels pretty good. So I check out, and there's still one little spot over here I could work on. So I scooted down on the chair, so I'm kind of in what I would call a recliner chair position. So I'm a little bit slid down, right? You can do this in a recliner chair on a bed. I don't usually do this in a dining chair, but I'm in my office and that's what I have here. I don't have the option of like recliner chairs or anything, because we don't do a lot of reclining around here. We save that for home. So I'm just kind of sliding that around, and now I'm going to take a couple of deep breaths because we talked about breathing, I believe, last week, where I'm breathing. Filling up my abdomen and exhaling. Breathing. So on the exhale, I want to tighten up this muscle across here called the transverse abdominis. You don't have to remember that name, but you just want to tighten up across here, almost like you're giving yourself a little hug. You're hugging your guts. Then I'm going to breathe in again. Because again, when I want to be specific to get all of the fluid in my abdomen moving, because any fluid and any swelling in my leg has to come back up through my body to get to the heart through my abdomen. So if my abdomen has back pressure or it's got fluid that's just causing pressure, it keeps the pressure pushed back into my leg or into my knee or my foot or my ankle or whatever that is. So I want to make sure that I'm getting that gut open and moving. All right. So I'm moving. Let's see if I can get this. Okay. So I'm going to put my foot on this bench. Now, this is what I would call my affected leg, which I've worked on so much. It's actually a little softer than my unaffected leg right now. Because I do this stuff on myself, okay? So I'm putting my legs straight partly so you can see it, but also so that I don't have bends in my lymphatic system. So I will even lay down or recline if I can so that I don't have much of a bend even at my hip joint. I want to have those vessels so that I don't have kinks in their hoses, right? Now I'm going to use my hands and I'm going to stretch my thigh up towards my heart. And I'm going to do that again. Notice that I stretch the skin on top of the muscle underneath. So you can be doing this too if you want. And I'm coming into this area at the top of my thigh right here because this is where you have a lot of lymph nodes where that fluid is going to come up through the lymphatic vessels. They're similar to blood vessels, but different. The walls of a lymphatic vessel are different than a blood vessel. And so, and blood vessels have windows. So things, big objects like big white blood cells and big proteins can't get into the blood vessel. Lymphatic vessels are flapped. So when I stretch the skin that the flap is hooked to, and I open up that skin, then big particles and fluids can come into that lymphatic vessel, which then goes and squeezes it up along the way of the path of the lymphatic vessel. So as I'm working on my leg, I'm actually feeling my foot is going, oh, thank you very much. That feels really good. Yes, it's true. My body talks to me like a child. So I worked that up, and now I want to get specific with my knee, right? Because I know a lot of us in this group have knee issues. So right above, I want you to feel your kneecap, which is a bone. So it's hard. But I want you to feel that kneecap and really get a good picture of where it's at. If you can't feel the edges of your kneecap fairly clearly, then you have swelling around your knee. There is swelling there. So we're going to come not on the kneecap, but right above the kneecap. So there's my fingers right above my kneecap. And I'm going to slide that up towards my groin, right? Towards this area of lymph nodes. So I'm going to slide up, I'm going to slide up. Now, the other thing I want you to feel is, do I have any bumps in that area? Like I have a little tightness right over here. So I'm going to turn around so you can see my tightness on the camera. So I have a little tightness right here. So I'm not going to go right on the tightness. That is what people want to do. They're like, you're not on the spot. And I'm like, I know, because it usually hurts. I mean, my spot doesn't hurt. It's not that tight. So you can, there's a little puff right here. So I'm going to go above that and I'm going to stretch above it. Because I want to see if I can stretch those lymphatic vessels so I get the flaps to open. So I can bring the fluid up out of that area. And I'm really listening if you're watching closely. Yeah, most of you are doing, I love that you're doing it on yourself. So don't worry, I can send you the video too so you can watch it again closer. But if you're watching closely, you will notice that my fingers are moving around the spot because the spot's right here. Let's see if I can get a good camera angle on it. And then I'm working around that spot to bring the fluid up out of there. So let's say you've had knee surgery. It could be a total knee. It could be, you know, an ACL repair. It could be a meniscus. You know, there's a lot of knee surgeries. So maybe like I had an incision right here, but maybe I have an incision down there. So I have like more swelling and more hardness. So what I'm going to do is I'm going to work along the edge of that scar. And again, I'm not going to pull on that scar. I'm just going to stretch the tissues. And sometimes the tissues can be so tight, like right in here, you can barely see any movement at all. You might barely feel any movement at all. And that's okay. I'm just going to do tiny little movements with that tiny little stretch. What happens over time, because this is like learning to play your piano, right? You got to practice more than once to really learn it. So what happens over time is I end up having more and more movement as I release more and more fluid and more stuck stuff. Because you get a lot of stuck stuff. I'm going to spare you all that physiology. Okay, so now I'm going to show you this outside of my knee. Behind your knee is actually what we call the popliteal fossa. And fossa means like a depression, a hole, a space that you should have in the back of your knee. If you don't have that space in the back of your knee, you probably don't have good knee movement, like you can't bend it well. So I'm going to take my hands like this, and I'm going to do what I call the scoop. So I'm literally coming in behind that area, and I'm not digging. Do not use pressure. You do not. You need to use pressure. You need to scoop the skin and stretch the skin on the tissue underneath. And you may feel an area where it's like, oh, that's really hard. Go above it, meaning closer to your groin, and work above that area for a few minutes, and then go back down and go, oh yeah, that's less full, less hard, less restricted. So you're listening to those tissues' direction. You're not going right on the hard, painful area. You're going on the areas where you can, where your body says, oh yes, that's where I need it. Not where your brain says, you're not on the spot. Because being on the spot can be, can actually cause more trauma and injury. So let's be kind and loving to our bodies. And do that gently. Okay. Does anyone have any specific areas that they're like, can you speak to this one issue where I would like to work on maybe a hard place that I have?
Mine is right in here, in the lymphatic area right here.
Okay, so what you're going to want to do is really work with those abdominal areas. Did you see the video a week ago?
No, but I want it.
Okay, so if you would be so kind as to
Put in the chat.
you can put it specifically to Vanessa. Vanessa Franklin is she's here in the office.
Kathy, I sent it to you yesterday.
Okay.
You may not have gotten
Oh,
it.
did you? Okay. I haven't really checked my email today until you said you're missing this call you wanted to be on. So, okay, great. Yeah.
So, yeah, watch that video because that goes into how to bring the fluids up and stimulate that specific area more than what I talked about today. And then you,
okay. You have no idea how much I need this whole thing, from what you're doing to what Ann's doing. I will probably watch this video over and over again. So thank you so much for what you're doing, Mary.
You are very welcome.
Yeah, I woke up yesterday and my whole left side was swollen. My foot was swollen, my knee was swollen, my hip was swollen, and I knew it was lymphatic. And then I got on the phone with Ann and she said, guess what we're doing? So the universe coming to my rescue.
So I'm really glad that you got to come. So yeah, if you want this video and you're not on my email list, put your email in the list. If you don't want everybody to see, you can do it through private with Vanessa Franklin. She's my administrative assistant, and she can put that into our system and we can send you that video. So this is our last of 4 sessions that we have done, and on using the body power system, using movement to balance our bodies so that we improve the way that we move and keep our bodies in balance. So I wanted to just say, what's your next step? Do you want to take a next step? Oh, you know, how far can you go? People ask me that all the time and I'm like, I don't know, because I haven't gotten there yet. I keep going and I keep learning. So if you are interested in, you know, getting those videos, of the 4 free sessions, you can certainly send us a message in the chat and Vanessa will get those out to you. You can also sign up for more sessions. So I have 2 different ways that you can do sessions. One is privately, one-on-one. They can be in person if you're in the Dallas-Fort Worth area. If you're not in the Dallas-Fort Worth area, many insurance companies are paying for online sessions right now because of COVID. So you can text your insurance card to our phone number, which Vanessa can put into the chat so you can see our phone number. And if you text your insurance cards with the driver's license, because we need your address and we need your insurance information and we need your birthday to get information from your insurance company. And we can request from your insurance company benefits for online services if you're not in the Dallas-Fort Worth area. And I have people in the Dallas-Fort Worth area who I do all online too. So you don't have to come in even if you're here. The other thing is that I am starting a class of body power system. The class is not covered by insurance, but it has a less expensive fee than doing one-on-one sessions. And so depending on how many people I have signing up for the class, we will start it either next week or the following week. I'm hoping there is 4 or 5 people to sign up for the class. And it will run for 4 consecutive weeks, 2 sessions a week. And we will do both a body power system and we will probably have Anne doing a session, which I didn't really discuss with her. So hopefully she says yes. I really put her on a spot right now. And then I'm going to do one other bonus session. So it's going to be 6 sessions of body power system with some other information about wholeness and healing interjected into that. And it will be less expensive than working with me one-on-one. So if you're interested in any of that information, again, you can write down our phone number and call us. You can send us your insurance information. Yeah, so there you have it. So I'm going to turn the time over to Anne because she's going to share some more information about how swelling can be affected by our emotions, because anytime you have a trauma, obviously the emotions are involved at some level or another, whether we show it or not, we have feelings. So she's going to talk about that. Anne.
Thank you, Mary. And I'm Ann Riddels. I'm a retired physician and psychiatrist. And today I'm going to focus on the lower extremity, continuing what we started last week. So if something's unclear, we'll have plenty of time afterwards to answer questions or to focus on specific problems within the wall.
Having a really hard time understanding you. It's like you're almost underwater or something.
Oh no.
Now that's better. Good.
Have to yell. All right. Lower extremity issues. Really the area where green soul parts that I talked to you about manifest. And these are the parts of ourselves that we have passed away from consciousness. We have been trained, most cultures were taught that some part of us is not okay. And males are discouraged from their emotional feminine side, or whatever that's defined in culture, we're discouraged from it as males. And similarly, females are discouraged from their masculine side. And so we get rid of parts of ourselves, and they, feeling rejected, run away to the unconscious mind where they live a separate existence. And they stay psychologically very young because they're not part of our growth producing life experiences. And being so psychologically young, their behavior is immature, like little children. So what happens with immature behavior? Well, these parts of us are acting without thinking. They're impulsive. They don't know yet that they have choices of whether to act on what they think or feel or not. And they act without having consider consequences to ourselves or others. And also, their actions are often based on past experience, as far as if they've had hurtful people in the past, they project that on people in the present, and they recoil from people who are loving and helpful. But they also can be fooled by appearances, approaching people that proceed to hurt them because they're not who they appear to be. So you can see these youngest parts of us have had some serious trauma because of their immaturity. That's a big part of it. They are too young to notice the complexity of life or the complexity of every person, and that most of us have many characters living inside us. They can't protect themselves or others from danger. Being so young, they're very easy to manipulate, just like little children. And they were created by trauma, meaning that we rejected them. We were taught some parts of us are not okay. They're inherently wrong. So we got rid of them, and often hiding them away in the unconscious mind. We don't even know about them. So these parts of us are traumatized with that. And on top of that, we put on all the experiences of our lives that we don't want, the traumatic things that don't go along with our brand, you know, our image, our storyline, what fits into our society. So that's a lot of trauma for these very young parts of ourselves. And as a result, they can regress even further, getting even younger in psychological ways. They can lose their humanity with all the trauma and their sanity. And they can become stuck in the paradigm of post-traumatic stress disorder. I call it just post-traumatic stress. I leave off the disorder because to me, it's not a disorder, it's an injury caused by overwhelming trauma. And what this looks like to be stuck in post-traumatic stress is these young parts of us automatically recreate their trauma. So let's say a man was molested as a child by a scoutmaster or priest, but he was taught in male culture that doesn't happen to boys. That only happens to weak girls. So he, oh no, puts it away in the unconscious mind. And so what part of him takes on that trauma? His passed away soul part takes it on. And so she, being so immature, will be recreating that trauma, automatically acting it out as little children do, because they're too young to share and talk about it and work it through. So he may be molesting children with no awareness of what this young part of him is doing. Equally, the other category of post-traumatic stress is automatically avoiding anything that reminds you of your trauma. So I get this a lot in the sense that I have an MD after my name, and people who've had medical trauma are, stay away from her. And rather than discerning what doctors, some doctors are very honorable, some are very helpful, life-saving, and others are not, and to be able to discern the difference. So the problem with these young parts of ourselves, out of many, is they're automatically recreating their trauma or avoiding their trauma rather than what a more mature person does, which is artfully, thoughtfully, prayerfully considering, how do I reach human needs? So if we don't know about these young parts, we don't know what they're doing. And this is where our souls come in, trying to alert us to these unconscious, unknown parts of ourselves, and they're acting out by giving us body symptoms to show what's going on inside us. And because these youngest parts of us are extreme, our souls can give us lower extremity problems to point out these extreme parts of ourselves. And they might also give us extreme injuries or problems, illnesses anywhere in our body to point out these extreme parts of ourselves. Or we might have extreme symptoms in our lower extremities. So let's look at a common problem in lower extremities, which is vascular disease. And we've talked about how our vessels go flow. And if we're not flowing in some part of our lives, we might have a blockage in our vessels, pointing out what we're doing. For example, as people in the flow of life, we need to be receiving what's coming our way that's edifying to us or edifying to others. And I find so often that people say, oh, I don't need that. And they bat away the very thing that, if not they themselves need, these young parts of them need, but they don't know about this. So they bat it away. And of course, these parts don't like us very much because we're not meeting their needs. And also, not everything is about us. Sometimes people need to give something. And when we're saying, no, I don't want that, we're not giving them the blessing of receiving what they need to give. And in those times, we can always receive it and find who does need this and give it to them. And also being in the flow is being willing to give what we're being asked to give. So always in that deeply sensing place of knowing what to receive and knowing what to give. And when we're not in that flow, blocking it in some way, we might have a blockage somewhere in our body, alerting us to what we are doing. And as I've mentioned, the right side of the body in my healing tradition so often alerts to a problem with our masculinity, our masculine side. And the left side of the body so often alerts us to a problem with our feminine side, because we all have both. And with vascular disease, we can have something called peripheral neuropathy, where the symptoms of that is we get a lack of sensation in some part of our bodies, or we feel prickling, tingling, some sort of odd sensation, or we may have weakness in that area of our bodies. And again, as a soul communication, this can mean that, well, it reflects the relationship we have with these extreme parts of ourselves. Numbness in the body means we don't have feelings for these parts of ourselves. We don't know they're there. We have no awareness of their presence, their feelings, their thoughts. We are numb. And that's what the numbness in the body is representing. Also, if the prickling or tingling is a problem with a peripheral neuropathy, that can be the stinging of these parts of us on our lives. They've caused us a lot of pain. They've caused our loved ones a lot of pain. That stings. Ooh. And we're feeling that in our bodies. Or the weakness of a peripheral neuropathy can be, well, these parts of us are weak in many ways. And they point out our weakness in the sense that we're not willing to take them on. We're not willing to admit those parts of ourselves. So many people would rather suffer a chronic disease, a chronic injury, chronic pain, rather than admit these extreme parts of themselves, that these severe symptoms are represented. So sad. We all know that our lower extremities are prone to injury. And with injury comes inflammation. In medical school, I learned the 4 Latin terms for inflammation: or calor.
And we can't hear you at all at this point. It's been cutting in and out, but now there's no sound.
I'm getting music.
Yeah, I'm getting music too.
I think it's fighting with her voice, the music.
I hear music too.
Yeah,
Okay.
every time you talk, it seems like music is trying to cut in.
Okay, this worked yesterday. I just put this little button on. Can you hear me now?
This is better for right now, yeah.
Okay. Oh, I'm so sorry. what I'm talking about is the 4 signs of inflammation, which in Latin are rubor, calor, tubor, and dolor. And what they mean is that we have redness, heat, swelling, and pain. And whenever you have an injury of the physical body, you always have to consider if it represents some injury of the psychological body. So if we look at just the word inflammation itself, it means anger. When someone's inflamed, they're angry, right? So we're hiding anger somewhere in our bodies when we have inflammation. And the word rubor or redness is also a component of anger. We get red when we're angry. And calor or heat. When we're angry, we're hot under the collar. So these are all signs that we've stored anger in the body. So again, if you have inflammation somewhere, be thinking about what you're angry about. And there's always a better way to express our anger than hiding it away in our bodies. The word tubor or pressure means that something inside us swelling, there's swelling somewhere in our psychological bodies. Where are we swollen? Like, where do we have a big head? I'm just so amazing. I'm just incredible. We just think our accomplishments are so much better than everyone else's. That sort of arrogance will manifest, big head, big somewhere else in the body, some sort of swelling. Or if we feel deflated, oh, I'm nothing, I can't do anything. Our bodies may be directing us in another location to get bigger, to think more highly of ourselves and become more prominent in our lives and in our community. So again, symptoms can be either showing us our condition or showing us the condition, the area in where we need to grow. And finally, dolor or pain. Anywhere in the physical body to me always represents some pain in the psychological body. So we need to investigate both areas, physically and psychologically. And to give you an example, I'm thinking of a woman I once worked with a while back. Her name was, we'll call her Sophie. And she had a horrible accident that left her right foot crushed and highly inflamed. So she had to have surgery. And after the surgery, it took many, many months for the swelling to go down. And the most resistant to the treatment was her little toe that was sticking up, very red, puffy, just protruding very, very strongly, very tender too. So I led Sophie in this meditative process where I asked her to tune into her soul and tune into that little toe. And what was that little toe saying to her? And she was very clear when she said, my toe is telling me I need to stick out more. I need to be more prominent in my community. And what was her story is she had had a tremendous amount of trauma growing up. And so she had learned to hold herself back naturally to avoid being seen by her abusive family members. And although that was protected as a child, as an adult, she was so holding herself back, she was hurting people by not sharing her gifts with them. She had some extraordinary spiritual gifts. And her little toe was saying, go out there, share your gifts, help people. And the pain of the toe was sharing with her the pain that she was causing others by not helping them with her gifts. So it was a really, really powerful experience for her, hearing that deep message of the soul that was trying to help her and help her community. So whenever you have a lower extremity symptom, it's time to sense into where you might be extreme. Are you extreme in your behavior? Or too much? Or way too little? Are you extreme in your emotions, emoting way too much? Or far too little? Or are you extreme in your thinking, obsessing, going on and on and on and on and on? Or not giving your actions enough consideration? whenever we have a symptom, we start alerting us to something inside that needs to be. So I thought we could talk about sort of symptoms that carry.
And you kind of dropped out again. I can barely hear you, and I'm sure people who have hearing difficulties can't hear you at all.
Okay.
So I'm not sure what's going on with that. And then I can hear like clicking, popping in the background. So I'm not sure what that is.
Okay. Well, I clicked that special button again. Can you hear me at least to share anything here right now?
Now I can hear you again well.
Okay. Anything you want to share about anything you're curious about, whether it's your own or others or something you saw on TV, as what it might be as a soul communication. And let's have a little discussion.
I don't mind, but I'm the guilty party on the music. I thought I had muted. So I've got to mute this background music. So just a moment.
Anybody else?
Well, is that better? Y'all can't hear that, right? In fact, Anne, when you were talking, I just had big old tears running down my face. So I did, when Mary was talking at the beginning, and she was talking about how trauma affects the lymphatics. And I had a deep, deep trauma about 2 weeks ago. And I've tried to be a real big girl about it and, give everybody the benefit of the doubt. And I came down with a bladder infection, which means I'm actually pissed off about it. And then Anne was talking about, what are you, where are you too big? Where are you too small? Well, it makes me kind of teary. I don't know y'all, so please excuse me for I hope I can be authentic with y'all. What kind of made me teary-eyed was that it frightened me so badly that I'm pulling in with my gifts and thinking I'm just not going to do what I know that I'm very gifted to do. And I think that that's what's got part of what's got all of this lymphatic system so clogged up. So anyway, and it really did hit me, what you were saying, because my lymphatic system is so clogged and in my extremities. So anyway, there's me being authentic with people I don't know, except for Rosemary and Renee. And Mary, I know Mary a little bit.
Well, and what you say about being a big girl, I just want to comment on that because so often we feel like we know what we need to do rather than sensing into our souls that always know better. And sometimes we need to have a little temper tantrum because we need to feel these parts of ourselves. We need to be able to take on what in order to integrate them into our lives and then together make more mature choices. So
I cried, I cried for about 6 or 7 hours, but apparently that wasn't enough. I was still pissed.
Yes, and there's so much there, right? There are tears, there are anger, feelings of anger, there might be some guilt or shame, or and to be able to allow all the different levels, all the different parts, all the different feelings, rather than just our favorite.
And that's difficult. That's difficult because you think, well, if I go in and I release the pain, I'll be okay. But then the body says, well, no, actually you're pissed off about it. And so then you got to deal with being pissed off. And then the body says, well, no, the choices that you've made because of this isn't really what we want. And so we're going to tell you that that's not really what we want. And so, it's so many layers to a trauma. We think, well, that trauma, we can deal with it. But yeah, there's just, you know, we put all these little parts. You say, well, that part over there, I don't need to deal with that part, that pissed off part. That's too nasty. But I'm not going to deal with that part. And then I guess maybe victim consciousness over here. So I'm going to do this over here, which is kind of a self-sabotage. And the body says, no, you're not going to do that. Or if you do it, this is what it's going to do to you. So great call, ladies, at least for me. Thank you, Anne, for inviting me.
Sure, and so often too, when we have these sort of internal dynamics of conflict, I don't know that, these people come into our to get our attention. If we won't take it here, maybe we'll take it here.
Yeah.
It's like that old storybook, Green Eggs and Ham, if you all have read that. How about green eggs and ham here? How about here? How about here? All right, I'll eat your green eggs and ham. We keep getting the message everywhere until we're willing to, okay. Take it on.
Yeah.
Anybody else want to share anything?
So I was smiling at what Kathy had said because earlier this week I got triggered by something, and it was bringing up old trauma, previous trauma from years ago, and I wasn't even making the connection, but I did reach out to Anne and said, hey, can you help me? And so we did a session that helped me to process that, and it did take me, we did the session, a number of things came to my awareness, but then the next morning, additional feelings came into my awareness, kind of like what Kathy was saying. Well, now the bladder is telling me a new message. And I had to go through several different layers of messages to get to the point where it was like, oh, now my tooth's not hurting. Yay. But I had to go through several layers of this messaging before I could get and allow my body to process that. And believe me, I was doing, and I talked about the neck in the earlier video, but I was doing lymphatic work on my neck to help the swelling, to help the pain in my tooth, but it was both the physical and I had to process some of that emotional so that that tooth pain stopped. And so I was just really grateful to have that tooth pain stopped.
Yep, beautiful. Anybody else? Well, our souls are urging our emotional and mental development through every symptom we might have. And rather than trying to just eliminate the symptoms and feel better, let's also hear that soul communication, these soul cries, and respond with hopefully our most mature humanity. And in this, I hope we can just work on ourselves every day, just as we feed ourselves physically, feed ourselves psychologically, work on ourselves psychologically, so we don't have to get these serious things that come along to try to get our attention, to get us to work on ourselves. And also our family members don't have to alert us to the problems when we're working on them already. So let's compel the growth of everyone by working on ourselves. Thanks for coming.
Thank you. Great event.
So I'm going to go over contact information again because when I use this video on other social medias and we're not live, the contact phone number for Innovative Therapy is 214-225-8530. The website is Innovative Therapy PC, all one string of letters, .com. You can go to Facebook and search the same thing, Innovative Therapy PC. There's also a Facebook wall called Trauma Stop. And that both Anne and I are sharing on that and connecting different things that we do and announcing different events that we're having on Trauma Stop. And let's see. Yeah, those are the main ways to get a hold of us. And if you would like to be on our email list, we don't send out, ridiculous amounts of email, but we do announce different events through the email service, and we will share these videos through that email service as well. So, Anne, do you want to share your websites or your website?
My website is annradelfs.com, and my email is gardenerofthesoul@icloud.com. And I will put them in the chat as well.
Yeah, my email is available on the website, or I believe on the Facebook wall, but it's mary@innovativetherapypc.com. And then there's also info@innovativetherapypc.com as well. So you can contact either one of us through those different contact methods. Again, this is a series of 4 videos. This is the last or the 4th of the 4 videos. So if you're interested in the other videos, then put that in the chat so that Vanessa can get your emails, and we can then not miss people in sending out the information. And be sure that you put in there that you're going to get I think it comes out of Mary at Innovative Therapy PC when I use the email service, so that that doesn't get blocked. Because I've had a few people and it's like, they ask for the information, then I can't get it to them because of their security settings on their emails.
I have a quick question.